How many surfaces do your hands touch each day? Phones, doorknobs, food, and other people are just a few examples of the hundreds, maybe thousands of surfaces your hands touch each day. Your hands pick up and pass along germs on every surface touched. In this video, you'll learn about how infections can be prevented by keeping hands clean, also known as hand hygiene. Hand hygiene refers to washing hands with soap and water, or cleaning with alcohol-based gels and foams. Practicing regular hand hygiene is the simplest and most effective way to prevent germs from spreading in healthcare settings and at home. Research shows that when healthcare facilities improve hand hygiene practices, the rates of healthcare-associated infections decrease. Good hand hygiene measures can help prevent infections such as central line-associated bloodstream infections, or CLABSI, ventilator-associated pneumonia, or VAP, catheter-associated urinary tract infections, or CAUTI, surgical site infections, or SSI, and infections from the hospital environment. The healthcare team will take steps to practice strict hand hygiene when caring for patients. This includes cleaning hands before and after touching patients, before and after performing procedures, after handling body fluids, before and after handling respiratory devices such as ventilators, and after touching equipment or surfaces in patient rooms. Healthcare facilities will also make sure appropriate cleansing products and equipment are readily available for the healthcare team, as well as patients and visitors. As a patient or caregiver, you can play an important role in preventing infections by speaking up and asking questions. Ask anyone who enters the room if they have cleaned their hands.
Oh, Chris was just reminding us how important it is for everyone to sanitize their hands before coming near my mom.
Of course. Thank you for reminding me.
Wash your hands often, especially before eating or taking medicines. Let the healthcare team know if you do not have easy access to products needed for your own hand hygiene. Hand hygiene is also an important part of preventing infections at home. The Centers for Disease Control and Prevention recommends hand washing over using alcohol-based foam or gel if hands are visibly dirty. The CDC describes the 5 essential steps to good hand washing as: wet your hands thoroughly, rinsing off any visible dirt; lather, using soap under running water; scrub both sides of your hands, between the fingers and under your nails for at least 30 seconds; rinse your hands thoroughly under running water, making sure not to touch the sides of the sink or faucet; dry your hands using a clean paper towel. Wash your hands using these steps, or clean your hands using an alcohol-based gel or foam, before and after eating or feeding someone, after using the bathroom or changing a diaper, after coughing or sneezing, before and after preparing food, after handling raw meat, after touching garbage, animals, or soiled tissues or clothing, after contact with blood or body fluids, before and after changing a bandage on a wound, before and after caring for a sick person. Hand hygiene is a critical part of preventing infections both at home and in healthcare settings. Along with the healthcare team, you play an important role in preventing the spread of germs. Talk with your healthcare provider if you have any questions about infection prevention or hand hygiene, and speak up if you have any concerns.